Well, today we're here with the Medical Missionaries of Divine Mercy. So please tell us who you are and what do you do with this organization?
I'm Janice Holley, and I'm the chairman of the board of Medical Missionaries of Divine Mercy, and I'm also the Vision Clinic manager, and I've been with the mission since 2003.
I'm the newbie. So Roberto, Orlandi, I am only recently I took on the role of president, but prior to that I was the mission lead for the Laredo mission that we do annually.
And so, speaking of what you do annually, what is the purpose of the Medical Missionaries Society?
We're a nonprofit. We're a not-for-profit Texas corporation under Section 501c3 of the tax code. And as a charitable organization, we are providing medical services, medical, dental, vision, even chiropractic, physical therapy, and spiritual services to the poor and needy as in various communities.
And what are some of the communities that you've served so far?
Well, our mission group started in 2002, and we started in Tamasopo in the state of San Luis Potosí in Mexico. And then from there, we went to Laredo, Texas. And then the next one started in 2014 in Costa Rica in the mountains. 2023, we started in the Philippines. And in 2024, we had one introductory mission to Dominican Republic.
And so how many people are we serving at these different missionary outreaches? What's an estimate?
So usually we're around the 1,000 mark. We can be more or less. We are actually very happy about the mission that just finished in the Philippines in Sagay and Cebu, and they came back with just under 1,700 people in 4 days. So, but it does vary. What we try to do is we have local partners, usually they're parishes, who give us their spaces, and so the classrooms for a week are transformed into clinics. As Janice was saying, they are very diversified, but maybe the offering that we have in the States is different from what we would bring to, for example, Costa Rica, where with Medicaid and the medical coverage, we don't see as many children, whereas when we go in Costa Rica, it's mostly children.
And what are some of the services that you provided in the United States, and how is it different from Costa Rica as far as the medical issues that you see?
Well, down in Laredo, we do provide medical, dental, vision, and sometimes we have a chiropractor, and we usually try to get a priest to go with us, so spiritual services and spiritual counseling as well. In that particular case, in Laredo, we see a lot of people who are diabetic. And we do provide 90 days of medicine, prescription medicine, and we do have referral options, which is a good deal. Like you have Harris Health here in Houston. Down there, they have Webb County Indigent Health Services. So after we see patients and we prescribe medicine for them, and they get their 90 days of medicine, we can refer them on to Webb County so that they can have further services for chronic conditions. And we try to treat the immediate infections right away. And then we also have, Webb County also provides services for surgery. They can provide up to $30,000 per year. And I have prescribed people I've referred for cataracts and glaucoma management and pterygium surgery. So we do have the advantage of having that referral service in Laredo. That's not always true in the other countries.
And what do you see as the need in the other countries? What's going on medical-wise? What trends are out there? Like, for example, in Costa Rica, dealing with children.
Dental is actually a modern problem. So even though we started in 2014, the issue with children's rotting teeth has actually been something more of an issue in the recent years, which goes to demonstrate bad dietary habits that are only emerging now, as the modern, let's say, industry is catching up even to these remote areas. So unfortunately, that's becoming a trend. But I would say dental is usually the favorite, even in Costa Rica, in Laredo, simply because of the cost that normally would be, beyond people's capabilities. We don't charge a dime. Anybody who shows up at our door, regardless of their origin, doesn't matter. In fact, we're even open to our volunteers. We had a Muslim dentist who actually is considering to convert. But it's not forced. It's a conversion that comes seeing Christianity at play, which we find very encouraging. It's a beautiful team.
We also have seen, the medical team has also seen there hardly ever diabetes in Costa Rica. These people are very cardiovascularly fit because they're climbing up and down mountains. And they're subsistence farmers generally living off the land. What they do see there are fungal diseases and parasites because they don't necessarily have clean water. And they're seeing very unusual things like leishmaniasis, which is a sandfly that puts a larva down on their arm. And we've actually had our doctors do surgery on these people for the leishmaniasis. And also, unfortunately, they use machetes chopping their way through the jungle to get down to where we are. And you see unusual things like machete cuts. So these people have to deal with different infections and things, and because there's not clean water, you have a lot of issues with infections.
When in your clinic, don't you also see for vision, because she manages the clinic, there's a lot of cases where the cooking takes place inside, and so there's a lot of ash and smoke. And so, unfortunately, their vision is...
That can affect their vision, and it also affects that smoke getting into their lungs. And we saw that also in Mexico when we used to go to Mexico, because they had open fires in their little... Essentially, it's a little kind of grass hut they live in. It's very primitive. And they're inhaling that smoke. And then it affects their eyes. Looking at that fire for long periods of time, that can also affect their eyes. We actually donated when we used to go down to Mexico. There was a man who told us that he had created these special, almost like a chimney that would go out of their houses and lead all the smoke out of the house. And we donated a lot of money toward these environmentally safe kind of chimneys connected to their little fire so that we could get this out of the little houses so they were not inhaling this and it wasn't affecting their eyes so much.
Okay. Well, speaking of supporting and donating, how can we, as a parish and as a community, support the medical missionaries? And how are you supported?
I've got a lot to answer on this one. I'll let you start. Okay.
Well, we do have a website, and that's under www.mmofdm.org, and we have a donation button where people can donate toward us.
We have actually updated that website, so the current MMofDM still exists. .org, but we also bought the domain MMDM.org, so it's easier to associate the name of the organization with the website. And they're now linked, but we will be migrating shortly. But yes, you can donate there. But there's to your point, there's so much help, there's so much activity that takes place, and people used to think, well, medical missionaries, it's all about the mission. Yes, but the mission needs to be planned. And so there's a lot of work and collaboration where we actually need input before we depart. The website in itself, all the communication, attracting people, letting people understand when we're going, which assistance we need. We have Susan, who for a decade or more has been volunteering, and she comes and provides entertainment for the children. That's not a medical profile, and yet it's essential. We have logistics.
She's a clown, our clown.
And they love her. Like if she's not there, they they're actively seeking and inquiring where she could be. We have, registration to take place. We have to deal with customs. All our medical equipment and medicine, we're trying to reduce the medicine part, but the equipment comes from here, goes to the country, and then has to come back. That customs, that's the whole process. So I'm an engineer, Janice isn't a medical professional, and yet here we are. It's where there's a will, there's a way, and God always puts the difference, which is incredible. The help that we need is really for people to show up and say, I love what you're doing, how can I help? And there's a place for everybody. And in terms of the funding, well, some people can't find the time or don't think they have the expertise to come, and that's fine too, and donations are absolutely welcome. We self-fund our missions. So MMDM has a budget. 40% of that comes out of MMDM, and we have to thank St. Laurence incredibly because most of that comes from your taglines and your black bag collections. The fact that social concerns is tied to the hip with all we do is a phenomenal support. But it's still short of that 60% that the single volunteers, not only are they taking time off, so often not getting paid for that period, but they're paying to go on mission to cover 60%, not of their lodging and catering and flight. No, they're also paying for the medicine, for the repair of the equipment, the food that we're giving out to the people that show up. And so, unfortunately, that means that our profile is usually people who are more advanced in their careers and that can make these decisions, whereas we want, young students, people who are coming out of university who need the experience. We offer sponsorship programs, but we would love to lower the rate and just make it more accessible. And for that, obviously, we're looking to bring on board sponsors and maybe grant applications, etc. But those are still in the works right now.
Okay, so how would someone from out of the pews of St. Lawrence or the community come to volunteer with the medical missionaries? Who would they speak to?
On our website, Janice's and my contacts are there. And we just introduced this week info@mmdm.org. So if anybody wants to follow up, we're absolutely open. There's the ministry fairs that St. Lawrence always gives us, accommodates our table, and we have a lot of very good leads there. People come, leave their name, and Janice is very good at making sure that somebody in the team follows up personally, and that personal part is very key because it is all about relations.
Well, may God bless your ministry. Thank you very much for what you do for our community and for the world. Thank you.
Okay, thank you.
Thank you.